Welcome back to Sleep Better TV. I'm Tasia Custodi. I'm joined once again by Dr. Blake Perkins of Dental Sleep Medicine in Vancouver, Washington. Dr. Perkins, let's discuss the mouth-body connection. Why should somebody pay close attention to their good oral hygiene?
Well, if you think about the mouth as the gateway to the body, a lot of things pass through our mouth. We use it to eat, speak, and so we have to really pay attention to what's going on inside our mouth because, believe it or not, it actually affects our overall health in many different ways. And most people will assume, well, I got to brush my teeth, I need to make sure I don't get any cavities, and that's kind of where the conversation stops. When in reality, if you don't practice good oral hygiene and develop things like periodontal disease, you can actually increase your risk of stroke, heart disease, diabetes. It can affect preterm weight in babies. There's just a ton of things that can happen with somebody who doesn't practice good oral hygiene.
Okay, so you mentioned health risks. Could you go into more detail about some of these health risks?
Sure. Let's start with heart disease. People who have periodontal disease are actually twice as likely to have some sort of heart disease, whether it be blockage of the coronary arteries, whether it be a potential for a heart attack, actually even stroke. The bacteria in the mouth, when they get into the bloodstream because of periodontal disease, that bacteria actually have proteins on it that encourage the blood to clot. So if you imagine these little bacteria getting into your cardiovascular system, encouraging clots to happen, we can see very quickly how easily it would be to block arteries and things. So that is kind of one of the first things I would mention. Also, if we look at diabetes, over 95% of people with diabetes have some form of periodontal disease, and about a third of those have so much periodontal disease that it leads to tooth loss. This is thought that because diabetics are more susceptible to infections, the infectious part of periodontal disease actually affects the rest of their body. Also, people with periodontal disease have difficulty controlling their blood sugar. So you can see that if you have problems controlling your blood sugar and you're diabetic, it's going to make your diabetes worse. And if you're a diabetic and you're more prone to infections, it's going to put you at a greater risk for periodontal disease. So it's kind of a two-edged sword. It's difficult to manage. Now let's talk about respiratory problems. If again you're thinking of the mouth as the gateway to the body and your mouth is full of different kinds of bacteria, if the bad bacteria that exist in your mouth when you have periodontal disease are able to pass down through into your respiratory system, they actually make it more likely for you to develop things like pneumonia, and they make you more susceptible to the common cold and other things.
So if there is a tip you could give people regarding their oral health, what would it be?
Well, obviously as a dentist, I'm going to say brush your teeth. Please brush your teeth. That's kind of the biggest thing because the mechanical act of brushing your teeth removes plaque from your teeth. And that plaque is basically the precursor to all the bad bacteria that can lead to periodontal disease and other problems. If you think about your mouth as kind of like a hotel with a lot of different rooms that house a lot of different kinds of bacteria, some good, some bad. If you set the stage to kick out some of the good bacteria, there's more rooms open for the bad bacteria to get in there. And the more bad bacteria that are in there, there's fewer rooms, obviously, for the good bacteria. And so unless you remove the bad and make room for the good, things are just going to get worse. So brush your teeth.
Thank you so much for your time today.
You're welcome.
My guest today has been Dr. Blake Perkins of Vancouver, Washington, and you've been watching Sleep Better TV.